Hi everybody, I'm Dr. Sally Foote. Welcome to my Facebook Live today here at the Bella Behavior Learning Center. For those of you who don't know me, I am a veterinarian and animal behaviorist with over 35 years of practice experience, and I take this experience now and share educational programs, CE on my website, as well as speaking and publishing. Today's Facebook Live, I wanted to talk about puppies. Puppies who are under 12 weeks of age who start to show food aggression. I have recently had a couple of consults that I've done. I do behavior consults. And these were in dogs 10 months of age, 8 months of age, that when they were 8 weeks old, 10 weeks old, very young puppies, they were already lunging and biting for anyone walking near their food dish, or another cat in the home walking by the puppy when the puppy was eating out of their food dish, or another dog, coming around them. So the staring, body blocking, meaning, coming up and hovering over a food dish, growling, snapping or attempting to bite, or actual biting. Those are all the increasing levels of food aggression. And for an 8-week-old puppy to show this, it's not normal. Okay, they're too young to really know or have that amount of fear developed in their brain development and their behavior development compared to the normal puppy to be showing this level of aggression. So I want to just talk a little bit about puppies and normal puppy behavior versus this abnormal puppy behavior, because it's very important how we recognize this as being abnormal, and they are not going to grow out of it. They're going to grow into it. It is going to get worse, and it may then increase to other forms of resource guarding, like guarding the bed, guarding the couch, guarding toys, guarding people, and go on. Two things, so a couple things I guess I want to cover is the developmental stages of puppies. So when puppies are born, they're with their mother, and the puppy should stay with the mother nursing until the puppy will naturally be weaned by the mother, meaning the mother is going to start to push the puppy away, stand up and walk away when the puppy is trying to latch onto her breast to nurse. And this happens at about 5 weeks of age to 6 weeks of age, because the teeth are starting to erupt. My little stuffed dogs here, they're starting to erupt through the gums, breaking through the gum line in the puppy, which is normal. And of course, when the puppy latches on to nurse from the mother, they're going to nip the mother a little bit, and this is painful. So at about 4 to 5 weeks of age, yes, we should have a bowl, or actually like a flat plate, where we've taken some of the canned dog food and we maybe mix it with some milk replacer or water to make a very soft gruel. And this is where the problem starts. So if we have just one plate, and we have 5 or 10 puppies, the bigger the litter, the more we get this food aggression developing in this puppy at this weaning, let's call it the weaning time period or pre-weaning time period. If we have one plate or one bowl, we set down, and then we have we have about 5 or 6 or 10 puppies all coming around on this bowl, and they are starting eating, and they're walking through, and they're hungry, maybe because a larger litter like this, the mother dog is getting up and leaving the puppies in this transition. So the puppies are actually competing over the food. And yes, they will start to, when they're going to eat, the bigger puppies, the more bold puppies, are going to literally push out the smaller puppy, and the smaller puppy is going to go hungry. And so the smaller puppy will start to say, hey, I got to eat. And that smaller puppy is going to come back and confront the other puppy. Now, if we allow mom to stay with these puppies through this 5 week of age, 6 week of age, 7 week of age period. This is what's really important. Do not wean early. Or if the puppy has been weaned at 5, 6, 7 weeks, about 5, 6 weeks of age. 7 is not quite so bad, but even 7 is about the cutoff. Mother dog, when she's still seeing the puppies, hey, you're messing around, you're starting to, too many of you cramming on there, she's going to get her head in there, and she's going to help to boot some of the puppies away so that we don't have as much competition. And what she may also do is if one of the puppies is like growling on the other one, she'll come in and she may put her mouth over this puppy, and what she's teaching is bite inhibition. Very important skill for puppies to learn. So even though the puppies may not be nursing off mother's presence to help the puppies with their social interaction and managing their, let's just call it exuberance. Their exuberance about the food, reducing it so it's not going up to aggression, is helping to decrease the competition with these puppies. Now, an astute breeder or person raising puppies would probably say, hey, wow, these puppies are really messing up. Mom's separating them. I better get more bowls out. And which is the wise thing to do. I like to see 1 bowl per puppy if we're in this wean transition phase, or at least no more than 2 puppies to a plate. And so you have to be structured when you're raising these puppies in these last 2 to 3 weeks, when we're in this transition period, of how you put the gruel out so we do not, literal space between the puppies so we prevent the competition. But unfortunately, we still have breeders. We still have just people, maybe in a mistake litter, and they just make open a big bag or a big plate, 1 down, 10 puppies all on top of each other. And they separate the mother from the puppies because maybe this mother going in and pulling one away is perceived as, oh, she could hurt the puppies. And she may, the mother may, especially if she's had so many litters that she's weak and, her body is basically depleted, that her behavior's not good. So the mother's been separated, and now we have the puppies themselves living like this. They're learning to compete on each other. And these puppies are actually, they will be behaving and following this ladder of aggression. This canine ladder of aggression is a very important tool for all veterinarians, veterinary technicians, staff nurses, shelter personnel, animal control officers, and any of our dog trainers to have and post on your walls. Always refer to this, and to give these to your clients. Give these out just like paper, because you will see in these young 5-week-old puppies, like the timid puppy is running away. They're creeping away because of the threat from the bigger, more bold puppy, and that you'll see the bigger, more bold puppy showing the stiffening up, staring, growling, or snapping, because the bigger, more bold puppy sees the little puppy as the threat. So this one goes up to aggression to beat the other one off, and it works for him. So that puppy learns to be more aggressive. Secondly, because they've lacked this learning the social cueing and learning the bite inhibition from mom in this early wean stage, these puppies have a much higher rate of being very reactive. Any kind of noise, any kind of movement, any kind of touch tends to have these puppies startle up and go to nip and bite and flip around much more readily than the puppies who could stay with mom till 8 weeks of age. So now we have a family. They go to wherever, a shelter, they go to a farm, they go to an individual home, or they go to a breeder. I've seen some of these breeders who are doing early weans, and it's not good. Anyway, so they get their puppy, and their puppy may be, they're told, 8 weeks of age. And they get the puppy home, and they're, we need to feed the puppy. So they get the bowl, and they put the dog food in the bowl, and when they set the bowl down, and the human is standing nearby, this puppy comes up and may stand over, and maybe the puppy hasn't immediately started eating. And the reason why, when the puppy is like hovering over, it's guarding, and the guarding is coming from actually where they're at, and that point is they're up here at this level, the stiffen up and stare level. And the guarding is because they're anxious, they're worried, like, am I going to take the food away? Even though I'm human, they still perceive me as a competitor. So if I think like, oh, you poor puppy, let me pick up the bowl and get it closer to you because maybe you can't see it, maybe you can't smell it. I reach down, this puppy goes, arr, like this. Happened to 2 cases this week, folks. These clients had puppies aggressively biting their hands at 8 weeks of age. Arr, I go, ooh, that's scary. And now I step farther away, just like, whoa, I guess I'll give him some space. And then the puppy eats. So the puppy eats. And I, as an owner, think, well, maybe it's just weird. Maybe he's just scared. It's his first few days. They say 3 weeks, 3 months, 3 days to help an animal adjust into their new home. So we'll feed him and we'll, and maybe he'll get better. But what they may be finding is that in the act of feeding, the dog is doing a lot of that still, the guarding. And maybe if the cat walks by, this puppy is snapping at the cat. And if the client is not getting to the veterinarian for that first puppy exam and checkup in 9-10 week of age period, because maybe the breeder gave the vaccination and did not have like the get them checked out in 3 days to hold the warranty up on your purchase, or the shelter is given the vaccinations and given the deworming and like, hey, you're good to go for the next month. We're going to have a month of this puppy escalating and increasing in this food aggression because there is no other professional really getting in touch with these people to help explain this or to ask, how are things going, whatever, and to then help this family with any steps to decrease the aggression. And if puppy classes may not start until after a puppy's had like the second vaccination, again, there's a delay. So these are some of the reasons why. Now, a second reason why puppies, we tend to see a higher rate of this intense aggression. Okay, we missed a lot of good social, mental development. There could be temperament, could be genetic tendencies. It could be coming from parent dogs who have a high degree of resource guarding and aggression. Temperament has a heritability factor. Okay, we cannot erase that. That's a piece of the pie. Okay, another part that adds to or aggravates food aggression is if there's any source of intestinal inflammation. Puppy still has roundworms. Roundworms are extremely common in puppies. You do not see them in the stool as a whole worm commonly. You only see them in the bowel movement when they have a huge amount. They have a very large infestation internally. And roundworms require 2 to 3 dewormings approximately 3 weeks apart before possibly being cleared. And you must do the fecal tests to look and see whether or not they're clearing of the roundworms. Hookworms are also very common in puppies. Now remember, the puppies may be born with roundworms. If the mother dog has roundworms, those puppies are born with them because they cross the placenta and they're actually developing in the puppy before birth. Hookworms are picked up from the soil. Just walking through the soil, the little larvae go right through the pads of their feet, and that's how they get infected. So the puppy may have hookworm in the intestines, and they cause ulcers on the intestines, and this pain is then a part of the aggravator, if you will, with the act of eating and hunger. So again, if our puppies need to be on a deworming schedule, it's not just a one deworming by the breeder and hey, they're all set. No, because we could also have Giardia. Giardia is a different kind of a protozoal parasite that's difficult to find in the fecal sample. It can be found, but that has to be done at the veterinarian and requires a different medication and deworming to treat that. And then lastly, whipworm and tapeworm can show up later in the puppy, but in the developmental, to test it, to find it, you may not see it for 4 to 6 months, but it's developing in the puppy's body starting at that 2 months of age when they now are wandering out in the grass and maybe eating other stools of other animals or any other dogs on the property, and that's when they pick up the infection, and the infection is developing in the intestines, doing its damage, doing its inflammation, and that can aggravate this puppy food aggression. So the puppies need to be examined at that 8 week of age by the veterinarian. Even if they have already been vaccinated and dewormed, they need an examination, and I recommend strongly a stool sample check. They need to get on their heartworm preventatives. The heartworm preventatives not only protect from heartworm disease, but they also protect from intestinal parasite reinfestation from the soil. There's HeartGuard, there's Revolution, there's Sentinel. These are all extremely safe. And we have too many dogs with heartworm, too many dogs with parasites. So clean gut and will help tremendously if we are faced with a puppy with food aggression, with the lunging and the snarling. So what do we do then if we have a puppy who is snarling, growling? Remember, let's go back to our ladder of aggression here. showing any stiffening up, staring, growling, snapping, that's a bite real fast and they're missing, or actual biting around their food dish, around any food object like a bowl, any dropped food on the floor, okay? Or body blocking, like if one dog comes in, then they come in and they're blocking it. So what do we do now? How do we manage this? How do we improve this? Because we don't, it's going to get very seriously worse very quickly. Okay, so the first thing is, as I said, we want to make sure we have a proper diet. We've addressed, and we've taken care of deworming, have them on a heartworm preventative. At this age, to be escalating up that high on the ladder of aggression, as I said, is not normal. It's not normal learning. It's also not normal brain state, emotional, mental state. These puppies actually have had like a chronic level of being anxious and now have moved up to aggression. And frankly, many of these puppies have other times where they're showing the signs of anxiety, but it's missed because our clients don't understand. So we need these puppies to be more mentally calm. And I strongly advise getting every one of these puppies on at least the Adaptal collar. You want the collar, please not the plugins, because this puppy is going to need the benefit of that mother dog calming pheromone to help decrease that chronic agitation, that higher adrenaline surge. They're always vigilant. These puppies are always kind of on the lookout for who's going to take my food, or is there food around, because there's commonly lots of food. So you need the Adaptal collar. These puppies may also need some form or some type of an anxiety reducing supplement. These are very young puppies. Few of them, some of them may require a pharmaceutical medication that must only come from after a complete behavioral analysis by a certified veterinarian in behavior. There are a few that really need things like fluoxetine and other medication. Many are improved with the use of supplements, but again, the use of the supplement should only come from the veterinarian based on the health of this puppy, the diet of this puppy, and that this puppy is cleared of any kind of GI parasites and is managed and maintained with a good, healthy gut bacteria with the probiotic. This is not the time to be messing around with trying different things off the shelf at the pet store, okay? So anyway, Adaptal collar, possibly supplement, to really help this puppy have a better mental state. I'm going to say it, a better mental state. Great. Now the second thing we're going to do is, frankly, switch your puppy to using all of their food for learning calm behaviors at home, like come when called and wait at the door as I put your leash on, and for lots of socialization. In my on-demand, online puppy course, the housebound puppy 2-hour course, I show how we're using the puppy's food for rewarding when come when called, rewarding as we clip on the leash, rewarding as we walk, rewarding as we meet people. They're earning their meal this way. So it not only helps with the socialization, but for the puppy who's food aggressive, now the puppy is learning, I am in control of this resource, not this dog, and that there is no competition for it. He doesn't have to fight me for the food. Actually, when he sits, boom, he gets it, but he's only getting 1 or 2 at a time, so we don't have a large pile that could trigger the guarding. He gets 1 or 2 or 3 nuggets quickly within that 1 second, so he learns his good training, and he also learns, oh, this freely comes from the human and from the hand. So this is a first step in decreasing that, just guarding about food in general. Now, if we want to go through the steps, this is a very long, very stepwise process. If we want to go through the steps to have a dog be less agitated about food in a food ball or going to feed in the food ball, then it advances to, I would have the nuggets of food in my hand, I'd have an empty bowl here, I'd call the puppy to come by and immediately reward the puppy as soon as they come by. I'm not commanding the puppy so much, I'm rewarding the puppy for me being near the puppy in the food bowl, and then I would drop 1 or 2 nuggets in the food bowl, and as soon as the puppy eats those 1 or 2 nuggets, remember, not a whole pile, just a small amount, I would say, watch me. And as soon as he looks up, he gets 2 or 3 more slightly higher valued pieces of food. What he's learning then is to not hover over the bowl. I get something better, and then I may toss in 2 or 3 more while I'm standing far enough back. I posted an article from ASPCA about it. What I prefer to do with these young puppies is use a lot more of just strictly the learn to earn, and then trading up and teaching them a correct trade up or leave it. Sometimes we use these terms interchangeably. So a correct trade up is, so let's say my puppy just found my sock and I want him to give me my sock. I need to not only get something he desires better than the sock, that's a trade up, but I need to, you know, say like, Buster, here, like get his attention. He sees I have the food, but I don't give it yet. He drops the sock, and I'm going to take 2 or 3 steps away from the sock and say, come. And as soon as he comes to me, I'm going to give him 1 or 2 of this higher valued food, just 1 or 2 small nuggets, so he's rewarded for coming to me. Then I'm going to toss maybe 1 or 2 further away from me. So he goes there, I praise him, then I pick up the sock. What we're doing is we're increasing the space and distance so that there is no, you know, reaching, because the puppy can see that as competition to get the object. He knows, ooh, if she shows up, I'm going to get rid of the sock and come around and go and, you know, go away from her. So it's not confrontational. It's very important to stop the grabbing and the mouthing and the pulling and all this out of the mouth for the object. Now, if the puppy, as you show up, immediately drops the food, always praise the puppy. If over time you can reward the puppy for keeping his head up as you go ahead and pick it up. But by and large, for many dogs, the act of just even reaching around them when they've just had a toy, a food object, your sock, something they really desired, that's why they picked it up and they were mouthing it, is still risky at any age for if you're going to reach right in front of that dog. I really, just for safety in general, we need to inform our clients and trainers, inform your, your students, and shelter personnel. This is extremely important because you may not find out that this animal might suddenly bite for reaching until it happens, is call that dog 2 feet away. And if the dog won't take that step or 2 away because they haven't learned trade up, they haven't learned leave it, if you can keep the dog's head up, like, watch me, quick reward, take your foot and kick the object away from the puppy. Because if in that moment, whether it's a puppy or an adult dog, they suddenly put their head down to bite, it's better you get bitten across your shoe than you get bitten on your hand or on your face. So that's a tip there. The Learn to Earn program, you can find a handout about this on the Dr. Sophia Yin's website for a free poster download. The Perfect Puppy in 7 Days by Dr. Sophia Yin, I think, is one of the best puppy books ever written. Lots of excellent color photographs, and she has an entire chapter. She has an entire chapter on puppy development, where she really describes and explains a lot of these stages in development in the normal puppy and where then you may see more fear. But the second chapter about get rid of the food bowls, we're going to use all the food for this training, and it helps to decrease not only anxiety and reduce competition in the dogs. She does it really well with a lot of photographs and that. In my Better Bond, Better Behavior Puppy Behaviorist Certification course, that's my textbook that is a part of that course. That's how strongly I feel about, using that book. The last thing I'm going to say is this. If you have a client that, or you see, okay, as a veterinarian, I would see it sometimes too. Maybe it was a 10 or 11 week old puppy because they already had their first vaccination by the breeder. And this puppy comes in and we put him on the table. We start the exam, and as soon as we, put the stethoscope on the chest, the puppy is flipping around and maybe trying to grab a lot with the mouth. Or, had this happen, my tech may have had a bowl with a little bit of, baby food or canned dog food on it. And when they present it to the puppy licks and then starts growling, is growling in that. My techs knew, they were highly trained. They, whoa, okay, we got a problem here with resource guarding. So then I would say to the client, this is what I would hand to my client. I want all of you out there, all veterinary staff, shelter staff, trainers, get these 2 handouts and have plenty of copies, I would give my client both these handouts. I say, okay, this is normal dog. It's normal dog behavior in a sense. It's just not normal to see it this young. And I want you to do 2 things. Whenever your puppy is looking like this, I want you to get the puppy away from what's upsetting it, or the object away from your puppy. If it's around food, I want you to tell me immediately, and we're going to get him on the adaptable collar. We're going to make sure he's dewormed, and I want to get him on the supplement, and then follow these steps for using all the food for his training, just like we're doing here in the office, to decrease his aggression. No one disturbs this puppy when he's eating, and this is how we're going to follow up with you. Now, I also want this chart, because what I really like it is when clients will, when they see especially that stiffening up and staring, standing over the food bowl, what exactly is going on? Is this when you put the food down and the cat walked by? Or you put the food down and you're still standing next to him within 6 inches? Or is it when you have 2 dogs and you've put the 2 bowls down and we've got 2 dogs side by side, and when the dogs are side by side as they're eating, and they're both eating really quickly, there's a look and eat, and look and eat, and a look and eat, and a look and eat. And that means both dogs are hovering under this stiffening up and staring, but they're eating so quickly to eliminate the competition source or product, if you will, the food, to try to stop the situation. But they need to write that down. And then once you know that, then you say, okay, we're feeding the dogs totally separate, each in their own room, or we have the island between the 2 so they're not around each other, and that way now you can identify the triggers that gets that puppy up to this point, because remember, it's all about trigger management. We want to eliminate the triggers or reduce the intensity and frequency of the triggers that we have. I hope this helped you, and especially with not only having ways to start to work with the puppies, but to understand how and why this is not normal puppy behavior. Puppies under 12 weeks of age, because 12 weeks of age is where we start to have that fear period starting to build. And if the puppies had any kind of handling or disturbances or stressors during eating before 12 weeks of age, then that can be more of the learned response to aggress later. I'm talking about the puppies that come to you at 8, 9, 10 weeks of age, 11, before the 12-week of age point, and they're already at growling over food, growling over a bone, growling over rawhide, or snapping and biting for any kind of, moving around them at that point. Because a puppy should not have learned or already be up at that high aggressive response like that at that point of age. And so with that abnormality, to understand and to emphasize to your clients that no, this is not normal, they're not going to grow out of it. We need to intervene immediately now. Please do not wait on this, because resource guarding to one category like food tends to increase to resource guarding over more categories like beds and resting places, or people, or access to space. Thank you very much. I appreciate you attending here. You can find more of my information and things at my website. So I'm trying to remember how to close it. At my website, drsallyjfoot.com. And I really thank you very much, because a better bond helps to build better behavior. Take care. Bye-bye.